The miracle of life you share with your newborn little one is one of life's greatest joys. But as human beings, our biology can sometimes sour the days, weeks, or even years after birth with mental health disorders that are in no way your fault. Today, we here at NurturedTX want to provide you with the information and tools you need to overcome perinatal mental health disorders and get back to being the parent you want to be. What are perinatal mental health disorders? Most people have heard of postpartum depression, but perinatal mental health disorders are not limited to just depression. They can also include anxiety, obsessive-compulsive disorder, post-traumatic stress disorder, bipolar disorder, and in rare cases, psychosis. 1 in 7 women experience postpartum depression. This is not the same as the baby blues, which last no more than 2 weeks after birth, and as many as 80% of women experience. If a depressed mood continues past 2 weeks or is interfering with daily life, it is time to seek professional help in diagnosing and treating a perinatal mental health disorder. Disorders can also begin during pregnancy or any time within the first year of postpartum. PMHDs are highly treatable with many excellent resources available to help you get through this difficult time. Symptoms. Symptoms to look for in identifying a PMHD include anger or irritability, lack of interest in baby, eating too much or too little, sleeping too much or too little, crying and sadness, constant worry, racing thoughts, fear of being left alone with the baby, possible thoughts of harming yourself or the baby, intrusive memories of a traumatic experience, flashbacks or nightmares, avoidance of reminders of the birth, such as people, places, or feelings, feeling paranoid or suspicious, rapid mood swings, losing touch with reality, and delusions or strange beliefs. With treatment, PMHDs can last a few months to a year. Without treatment, they can last up to 3 to 4 years. Why? The exact causes of PMHDs involve multiple complex factors. Hormonal changes during pregnancy and childbirth, such as shifts in estrogen and progesterone levels, can significantly affect mood and mental health. Psychological factors like a history of mental illness, stress from social or financial challenges, lack of support, or a traumatic birth experience may also contribute. Additionally, the emotional and physical demands of caring for a newborn can increase the risk of developing a PMHD. Perinatal mental health disorders can affect anyone, regardless of your prior mental health history, and they're not a sign of weakness. It's important to understand that you did nothing wrong. There's nothing wrong with you as a person, and experiencing PMHD does not make you a bad parent. Types of PMHDs. Postpartum depression. Postpartum depression is the most common complication of childbirth, and like other depressive disorders, can leave those affected with a loss of joy in life and lack of energy. Interest, and cycle of guilt. These feelings can be due to several factors, including hormonal changes, biological reasons, stress, or a history of mental illness. Postpartum anxiety. About 10% of birthing parents experience significant anxiety after childbirth. Sometimes they experience anxiety alone, and sometimes it's accompanied by depression. Postpartum anxiety may take on other forms as well, such as panic attacks and obsessive-compulsive disorder. Panic attacks come in waves. They may be frightening, but they cannot hurt you. Post-traumatic stress disorder. Perinatal PTSD may be triggered by a traumatic or frightening birth, or if the parents or baby have a medical crisis after the birth. Postpartum PTSD is treatable with trauma-informed professional help. Some common causes include pain or injury during labor or delivery, emergency during labor or delivery, C-section, risk to baby and or birthing person, feelings of powerlessness, helplessness, poor communication, and or lack of support, lack of multicultural competence or cultural awareness, lack of consent or choices in the birthing process, Perinatal PTSD may also occur if an individual experienced any trauma before labor and delivery. Previous traumas can be triggered during pregnancy, labor, delivery, and the postpartum period. Trauma before pregnancy birth can include child abuse, sexual trauma, intimate partner violence, race-based trauma, and discrimination, medical complications, natural disasters, injury, illness, previous birth trauma, pregnancy complications, or infertility. Postpartum psychosis. Postpartum psychosis is an extremely rare condition, affecting about 1 to 2 birth-giving parents out of every 1,000 births. Postpartum psychosis is temporary and treatable. It is, however, considered a medical emergency, and if you suspect you or your loved one has postpartum psychosis, you should seek help immediately. A small percentage of the birthing people with postpartum psychosis can end up harming themselves or their children due to irrational or distorted thoughts. These irrational thoughts can be extremely important to the birthing parent, and a person with psychosis is often completely unaware of their condition. How to treat PMHDs. PMHDs can be addressed through a multitude of resources, including psychotherapy, medication, and support from family or community resources. Cognitive behavioral therapy is commonly used to address issues like depression and anxiety, as it helps individuals challenge negative thought patterns. Antidepressant medications such as SSRIs may also be prescribed and are often considered safe to use during pregnancy or breastfeeding. If you or someone you know is experiencing symptoms of a PMHD, talk with your obstetrician gynecologist about what you are experiencing. Know that you are not alone and that this feeling is not forever. Many experiencing PMHDs find camaraderie with other parents in support group settings, learning strategies to manage mental health needs. Postpartum doulas can also provide support and encouragement for new parents who are struggling by helping with household tasks while adjusting to having a new baby. If you are located within the state of Texas, we at Nurtured would love to personally help you through this process. Nurtured Texas's Christie's List Provider Directory is a vetted directory of mental health care providers who specialize in and are licensed to treat perinatal mental health disorders. Our Central Texas Connect to Care program also provides mental health treatment at a steep discount to low-income women in Texas struggling with PMHDs. Finally, our Mamas for Mamas Texas program is a free online support group for those suffering from perinatal mental health disorder symptoms in Texas. Breaking the stigma. Studies have shown that many of these disorders go undiagnosed or untreated, largely due to the stigma and lack of awareness surrounding mental health issues in the perinatal period. While the focus has traditionally been on mothers, up to 10 to 15% of fathers also experience depression or anxiety during this time, especially when the mother is also struggling with a mental health condition. 1 in 10 men may experience depression and anxiety during the perinatal period. PPD in fathers is less recognized, but it is just as impactful. Partners are also less likely than birthing parents to report feelings of sadness, and men are much more likely to mask depressive symptoms through avoidant or numbing behaviors such as substance use or overworking. Summary. We at Nurtured Texas would like to remind anyone struggling with PMHDs and all mental health disorders that you are seen and heard. Know that you are not alone and that this feeling is not forever. We encourage you to use this video as a directory to the information and tools you need to get back to where you want to be and be the best parent you can be.